I'm Eliza Ramsey. I'm an Applied Public Health Informatics Fellow placed with the Alaska Department of Health. Being an Applied Public Health Informatics Fellow means that you are kind of early career professional with an applied learning opportunity to understand what it looks like to do informatics work in a health department. Informatics is kind of a new, emerging, evolving space in public health, and so that means so many different things. I kind of describe it as anything that is related to how the department can better move public health data.
The Applied Informatics Health Fellowship Program has been amazing in the state of Alaska. I didn't really know much about this program prior to us getting our first fellow, and that experience having her over the last 2 years has really shown me the benefit of this fellowship in so many ways. She has been able to work within our sections, like our section of epidemiology, across other sections, like our biostatistics and analytics, as well as across other divisions within the Department of Health and across other departments, to really think about how do we have systems better work for the needs that we have.
I picked the Informatics Fellowship because throughout my kind of prior work experiences in public health and my training as in a kind of an epidemiology MPH program, I was running into kind of data walls left and right. And I kind of realized the way I am and how I approach things, I couldn't write about limitations in data forever. And I needed to think about kind of going upstream and equipping myself with some of the tools about how do we get better data in the first place. I didn't have informatics training and background. I got a little bit of nuggets of it in my education. And so being able to have a professional development opportunity that really focused in on-the-job, project-based opportunities to understand what informatics is and how it can make a difference in an agency is really great opportunities. On one hand, I get to be kind of really on the ground and in the weeds and in the code, but I've also had the opportunity to work on kind of some agency-wide conversations about policy and resources and priorities.
A lot of our team is grant funded. They already have gigantic jobs, and it's hard to ask them on top of that to really step back and think about where are we going with data modernization, where are we going in general with information and informatics and that applied informatics. It's been great to have the CDC fund a data modernization position, and she's worked really closely with the person who's in that data modernization position. Eliza has been a go-getter, a problem solver, incredible positive attitude of let's explore, let's figure it out. She has been able to be this place to be able to balance ideas and questions off of, as well as has the space and capacity to think about things differently. So for example, we had a lot of dashboards that I know many states did during COVID, and we for a long time have had what we call the flu view, which just had a description of what was happening with flu around the state every week. So Eliza was able to work directly with our team, see what was already out there, work with others, and both her training allowed her to be able to do most of the work on her own, and her personality and partnership allowed her to work really well with our teams to be able to put together what's now called our respiratory snapshot. And so now we have a respiratory snapshot that's updated weekly that has RSV, COVID, and influenza. It looks at hospitalizations, it looks at overall capacity, it looks at our syndromic surveillance. It's available to the public. It has our case numbers on it. She was really able to help us transition kind of out of COVID to take the lessons that have been learned, the public's interest and honestly demands on having better dashboards, more information, more real-time information, and our needs to streamline a lot of this and put it together in an incredibly useful tool that I use all the time, both as a practicing emergency medicine physician or as the state medical officer.
We need folks who have been kind of subject matter experts and EPIs for a really long time, kind of plugging in and helping us think strategically about how we can better create data systems and processes to serve the work that they've been doing for a really long time. And then we also need people who are starting out in their careers to build into this new space and help develop it and grow it. Public health is ultimately about ensuring that there are the community conditions by which we all can lead happy, healthy, full lives. If we can more efficiently manage data within the agency and then share it with partners, then all of our partners can do their best work. And then there's our own team. I want to empower our epidemiologists and our nurses to be able to do the work that they want to do to care for communities and ensure that they have the data and the tools to do their work each and every day. Public health matters because we live in communities and health is defined by the communities around us. And I believe, that data is at the core of that. It helps us form partnerships, it helps us make decisions, it helps us provide care when and where it's needed. And especially in the face of, not a lot of resources, not a lot of money, not a lot of people, we need to really efficiently use the data we have.
I think it's really important to think of this fellowship not as just a beginning and training for that fellow and for the team, but it's also a beginning and a training for that division and that department to say, how can we better do this information? And just as she's going to grow into an amazing informatics lead, our team is better off because we have seen the possibility of possibilities having her here, and we are growing in ways to support that work more structurally and long-term within state government.